called Changing the Course of Multiple Myeloma. So the IMF's, if you will, empowerment vision is to advance early and equitable access to myeloma information, screening when it's necessary. We don't screen routinely now yet, and treatment in vulnerable communities worldwide. And it's a bold statement, but as I mentioned earlier, our focus today is within the African American community because myeloma is so unique in this population. But we really want to make a difference worldwide, as we've had the privilege of doing. Brian and Susie Dury, as our founders and our leaders, have just so marvelously put the I in IMF, the international in IMF, and have helped people all over the planet. And that is our goal, to continue that and to reach even further and deeper into our communities. And so with that sort of broad goal, our African American initiative is really an important aspect of that. As I mentioned, the 4 pillars of what we do in multiple myeloma, we know that this is a problem. Many people have tried to make a big dent, and we've seen amazing individual work, like just hearing about Dr. Blue's work today and what he's been able to do, what Dr. Nuka, as you're going to hear in a moment, does in his research, what Charisse and Jamaica have done in so many aspects. But we know that more can and should be done. And we believe that the IMF is poised to be able to do that because of our connection. And so our goal is to improve the short and long-term outcomes of African American patients through really 3 major approaches, which is engaging the African American community, of which now, for example, our work in Atlanta is being kicked off, as it were, with this workshop. To educate the primary healthcare community, I'm going to come to that in a moment, how important it is to teach them the basics. And Brandon said it so beautifully, how important it is to be able to do that. And then supporting the hematology oncology community as they care for patients, and of course, patients and their caregivers themselves. So part of what we're hoping to empower you to do as an attendee is to know the signs and symptoms of myeloma. If you're here today or you're listening to this, it has been sent to you, and we may not be able to, and you don't really know if you may or may not have multiple myeloma, we want you to speak to your doctor about it. We can't be doctors over the internet to you, and see if you may potentially need the testing that is necessary, and that you talk to your friends and family about multiple myeloma after this workshop. Let's demystify it a little bit. Let's have people understand what it is. I'm going to show you in a moment where you can go on our website to learn so much more, to be empowered, as it were, through the toolkit that we've provided. And so what we have done in our community outreach is that we started back in February with a social media campaign during Black History Month. And we've done, as you can see, there's a whole list of things. I'm not going to go through them all, but we've done workshops like this one. And really, we've built so much of this at our Empower website. And you can start, even just to keep it simple, by going to myeloma.org. And at that website, which is the IMF's main website, you'll see that we have an Empower website, and we have so many resources available to you where we can share with you details of what we have in what we call the toolkit, where you can find a support group. You can learn more about what myeloma is. I do just a really short 3-4 minute video on what myeloma is and what those signs and symptoms are. We can learn more about how you can make that decision, as Dr. Nuka was sharing, about all the different treatments that are available to you, what other resources can be available to you, to your caregiver, and trying to navigate through some of this challenging features of the healthcare system here with drug reimbursement information, and then to hear real life stories. This is Tiffany Williams, who is interestingly both a nurse and a patient, and she can share, and she does share so beautifully, her story and finding her voice and being able to speak to her healthcare team about her preferences and share with us a little bit of her journey with multiple myeloma. And then, as I mentioned, not only are we engaging the community, but we are very much trying to educate the primary care doctors who may not appreciate the importance of this diagnosis. I know this has come up several times before, where our goal is so they can recognize the early signs and symptoms, They can distinguish myeloma from other diseases like diabetes. A lot of times we've heard from many of our African-American patients, oh, I was told that my protein in my urine was just from my diabetes. Oh, my low hemoglobin, my anemia, I was told I have that just because I'm Black, or just because I have diabetes. These kinds of things need to be looked at more carefully, and then teach them how to make the right diagnosis. And so we've created this postcard and a program where we just really narrow it down to those CRAB features I shared with you: the calcium, the kidney, the anemia, the bone disease, and the 3 key tests that a primary care doctor can do to actually come to essentially the diagnosis, so that they can send them on to a hematologist and oncologist to confirm that diagnosis with a bone marrow test. And so in doing so, we have started our program, and we've worked in Charlotte, we've worked in Baltimore, we're now, of course, in Atlanta, and we're really looking to many other places. And we think over this next year, we're going to have outreach furthermore into Detroit, into New York, and perhaps many other regions as well. So this is something we don't want to pretend that we can just, do a one and done, where we just come in and fix something and leave that city. No, this is why we're partnering with Emory and Grady and Atlanta and many others in the region, so that it's a long-term strategy. The IMF will always be here to provide the information, as you can see here in our multiple venues of reaching out to us through the website, the specific Empower website and the specific Empower Atlanta website. But we need the local communities to be able to deliver the care to our patients. And so it's so important that this partnership is a long-term strategy. And so although we're going to different places, we're never going to leave Atlanta. We want to be there in the long term. We have marvelous individuals there through our support groups, our support group leaders that have been so helpful to us working through this program. And we really want to help. And if you think you can benefit from our help, please reach out to us. As I mentioned, through the website, we have an info line that runs during the weekdays from 9 to 4 Pacific time at 1-800-452-CURE. And please don't ever hesitate to reach out to us.